There's a real range of experiences that are completely usual to have through this time while you're adjusting to having had a baby. But there are definitely some red flags to look out for. And as a mental health professional, that I would want people to tune into a little bit.
Welcome to this episode of the Bump in the Road podcast. Bump in the Road is brought to you by Derbyshire Family Health Service, part of Derbyshire Community Services NHS Foundation Trust. Today, Dr. Claire Scothern, a clinical psychologist, talks about mental health in pregnancy and when you have a baby, and when your thoughts and feelings might mean you need further support. Please be warned that this podcast may cover topics that are sensitive for you. If you feel like you need support, our contact details are listed at the end.
Okay, so let's talk about when to be worried about your mental health then through that perinatal period. So through the end stages of pregnancy and postpartum. So once you've had your baby. We've talked a little bit, I think, generally about mental health being something that isn't static, and it definitely doesn't always stay stable when you are pregnant and afterwards. So there's definitely a normal collection of experiences that women might have. So anxiety might be higher generally. Your sense of responsibility for your baby is so big that can bring extra anxiety and panic for some women. It can also bring, thoughts, quite extreme and unusual thoughts around wanting to harm your baby, or what if someone else harms my baby, or what if in extreme circumstances, what if I kill my baby or someone else kills my baby? People can have quite I suppose significant thoughts around cleanliness and needing to keep everything sterile in case something happens. Having ups and downs in mood is normal, and also kind of having flashbacks, like thoughts about memories about birth, can be normal. So there's a real range of experiences that are completely usual to have through this time while you're adjusting to having had a baby. But there are definitely some red flags to look out for, and as a mental health professional, that I would want people to tune into a little bit. So sleep deprivation can play tricks on our minds. That means it can make us feel heightened to risk. It can make us be on the lookout for bad things to happen, which again means we might be a bit over concerned about our babies or over worried about other people around our babies. It can also cause our mood to go up and down. It can also cause the wobbliness, the panic, and so on. But as a kind of rule of thumb, I would say if your mood is low and it continues to be low for a period of several weeks, and you are struggling to find any joy in the process of being a mom, if you are having dark thoughts that feel too overwhelming that you're unable to get away from, or you start to worry about acting on these dark thoughts, if you're having anxiety to the point where you're struggling to get into a routine, leave the house, if panic is preventing you from eating, if you are really stuck and the distress that you're having around these things is big, then I would say that's the time to speak to somebody. That doesn't mean that you are going crazy. It doesn't mean there is anything significantly wrong with you, but it might mean that you might need that bit of extra support to get back into a routine or to manage some of these difficulties. You might be dipping into a depression, in which case there's plenty of things that can be recommended for you to help you stay well around that. And equally with anxiety, panic, intrusive thoughts, there are things that professionals will be able to reassure you about and add in for you to support you. Not always medication, sometimes just strategies, and again, relying on having some support and rest can be really helpful. I think it's important to mention birth trauma at this stage. So some women go through incredibly traumatic births, which results in kind of physical and emotional scarring, I guess you could say. And again, while there's a period of adjustment that is usual after giving birth, so thinking about the birth circumstances and having memories of it, feeling upset by it, is kind of usual up to about 6 weeks post giving birth. But I would say if there is a strength in these thoughts and feelings and memories that persists, that carries on after 6 weeks, and you are struggling to shake these memories from your mind, if you're having bad dreams, if you're wanting to avoid talking about the birth or thinking about the birth, and you're feeling incredibly distressed, then I would definitely be reaching out at that stage. It might be that you're developing post-traumatic stress disorder, which can happen post-birth, and again is easy to treat. So that's the most important message, is none of these difficulties, even if it's the first time you've ever felt like this, none of these difficulties are hard to tackle with the right support from the right professionals. We do have services in Derbyshire that look after people that are having mental health problems in the perinatal period. So it's definitely nothing to be ashamed of. It's absolutely something that professionals want to help you with and want to hear about. There is a very normal concern people have around safeguarding, and does this mean my baby will be taken away from me if I tell a professional how I'm feeling? And absolutely not. Let me reassure people that what professionals want post-birth is for everybody to feel safe and happy, and sharing these what can feel really overwhelming thoughts and feelings to a professional does not mean that you're going to be taken away from your baby.
If you're struggling with your well-being during pregnancy or with your baby and you feel like you need some support, you can contact Derbyshire Family Health Service on 01246 515100 and make an appointment with a health visitor. You can also text us on 07507 327769. This is a confidential text messaging service for parents-to-be and parents and carers of 0 to 5-year-olds, providing advice and support from one of our healthcare professionals from Monday to Friday, 9 a.m. to 4:30 p.m, excluding bank holidays. You can also visit our website at derbyshirefamilyhealthservice.nhs.uk.